across the UK. It is a magnificent achievement. First slide, please. And as of yesterday, 20,275,451 people have received a jab. I want to pay tribute to all the teams involved across the whole of the UK who've been delivering the largest and fastest vaccination programme in British history. And that we've been able to do this, and that we've been able to move so much faster than any other similar sized nation, has depended on a huge number of people. It is not an accident, it's down to insight and hard work. For the last year, this team has shared a challenge, which is to deliver us a vaccine as fast, as safely possible. We've got used to saying thank you to people who've made it happen, but I just want to call out a couple in particular. Firstly, the regulator, the MHRA, who have remained tough and rigorous throughout, yet flexible, so that it's safety, not bureaucracy, that they focus on. And they have proved themselves to be, in my view, the best medical regulator in the world, and we are all very grateful. Next, the Vaccines Task Force. Their combination of academic excellence with private sector entrepreneurialism and civil service grit has forged a team of remarkable capability, which is a model for how governments can get stuff done in the future. The scientists, the pharmaceutical companies, the armed forces, everyone involved in the delivery effort, from the leadership of the NHS through to every local volunteer, and you, the British people, for sticking to the rules and for the remarkable enthusiasm to get a jab, which makes me really proud. Recent figures show 94% of those eligible have said that they either have had a jab or will get a jab when they're 94%. And this is so important because each and every jab makes us all safer. Every time a friend sends me a message with a picture of them having had their jab, and this happens to me a lot, I know that we're all one step safer, and we're all one step closer to returning to normality. So it is fantastic the enthusiasm that people are showing, and we've still got a long way to go, so let's stick at it. Today we have some new data to show on the effectiveness of the vaccine. Both its real-world effect that we can now see in the data, and some new analytical research that we're publishing that shows how it's saving lives. And this is being published in a paper by Public Health England and others right now. First, let's look at the real-world data. Next slide, please. If you look at the number of new cases, as we described on Friday, the number of new cases is falling, but the rate of decline has slowed. This shows how we all need to keep sticking to the rules. Let's not blow it now. However, next slide please. The number of hospitalizations is falling faster. Even better, among the age groups who were vaccinated first, so the older age groups, the fall in hospitalizations is faster than in the younger age groups who are still yet to get a jab. This is a sign that the vaccine is working. Next slide please. The way you can really see it is in the data on deaths. We can see that the number of deaths each day is thankfully falling much, much faster than in the first peak. And again, as you can see from this slide, it's falling faster in the over 80s, who got the jab first, than in the under 80s. Final slide, please. Taken together, this difference in the data between older and younger groups shows a vaccine gap. You can just see it starting to emerge here over February. This is a gap between the rate of decline in older and younger groups, where the older groups were obviously vaccinated first, and you're seeing that the rate of decline in terms of the number of people dying each day is going faster amongst the over 80s. And this shows in the real world across the UK right now that the vaccine is helping both to protect the NHS and to save lives. And these real world effects are backed up by some exciting new data that shows that a single shot of either the Oxford-AstraZeneca vaccine or of the Pfizer vaccine works against severe infection among the over 70s with a more than 80% reduction in hospitalizations. This is extremely good news. In fact, the detailed data show that the protection that you get from catching COVID 35 days after a first jab is even slightly better for the Oxford jab than for Pfizer. Albeit, both results are clearly very strong. Professor Van-Tam is going to set out more details in a moment. These results may also help to explain why the number of COVID admissions to intensive care units among people over 80 in the UK have dropped to single figures in the last couple of weeks, which is something I know that we all welcome. This is seriously encouraging. It shows the power of science, and what it means for you is that when the call comes, get the jab. The evidence shows that it will protect you and protect others. And I can formally announce that we're now inviting the over 60s to be vaccinated, all part of our national effort to ensure everybody is offered the vaccine, every adult, by the end of July. To do that, to make sure our vaccine programme is always kept up to date, we are making sure that the programme has the funds that it needs to do all of this incredible work. At the budget on Wednesday, the Chancellor will set out £1.65 billion worth of new government funding to reinforce our vaccine rollout across all parts of the UK. As more of us are protected against the virus, we can gradually replace the safety that comes from the restrictions that we have to impose with the safety that comes from the job. Part of that funding will go towards further vaccine testing and development to make sure we are as fast and effective in developing the next generation of COVID vaccines, including vaccines against new variants, as we were with the existing ones. And there's a huge amount of work underway to ensure that we can develop vaccines against variants as fast, as safely possible. Finally, I want to turn to a different subject. The 6 cases of the variant of concern that was first identified in Manaus in Brazil, that we have identified here in the UK, 3 in Scotland and 3 in England. We know that 5 of these people quarantined at home as they were legally required to do. We've been in contact with them and their families, and we're grateful to them for understanding the seriousness of the situation. We're putting in place surge testing in South Gloucestershire as a precaution, and I urge everyone to remain vigilant. 1 of the 6 completed a test but did not successfully complete contact details, and we're therefore asking anyone who took a test on the 12th or 13th of February but hasn't received the result back to please get in touch by calling 119 in England, Wales or Northern Ireland, or in Scotland 0300 303 2713. And Dr. Hopkins will give more information about this effort. We identified these cases thanks to the UK's advanced sequencing capabilities. We know about them because of the work of NHS Test and Trace. And scientists around the world are now working hard to get ahead of some of these new variants, looking at how much a 3rd vaccine dose could tackle these evolving mutations if it's necessary, much as we tackle mutations of flu each year. But for now, tackling this disease rests with every single one of us. It's important to remember that no matter what variant it is, COVID spreads in the same way through social contact between people. The steps that we can all take to stop its spread are the same. To stay at home, to take vital steps like hands, face and space, and make sure we observe the basics, letting fresh air in, and keeping to the rules on social distancing. And that's how we can keep ourselves safe and protect the people around us. And if we do that, surely as spring follows winter, there will be brighter days ahead. I'm now going to turn to Dr. Hopkins to set out more about the P1 variant, and then to Professor Van-Tam on more details of this excellent research into the impact of the vaccine.
Thank you, Secretary of State. As has widely been reported, this weekend we identified 6 cases of a new variant of concern in the UK. 3 cases in England and 3 in Scotland. This variant, called P1, has been identified widely in Manaus, Brazil, and also in other countries across the world. We are tracking it closely because it shares some important mutations with the variant first identified in South Africa, such as E484K and N501Y. Unusual names, I understand. These and other mutations are associated with reduced impact of antibodies against the virus in laboratory experiments. The current vaccines have not yet been studied against this variant, and we will need to wait further clinical and trial data to understand the vaccine effectiveness against this variant. In the meantime, it is important we track cases of this new variant as closely as possible in order to limit its spread in the UK. Of the cases found, 2 are from a single household in the South Gloucester area. This individual was traveled back from Brazil and is subsequently isolated effectively at home. The household developed symptoms shortly afterwards, and household members went forward, got tested. The sample was sequenced through our sequencing laboratories and reported to be this P1 variant. As the Secretary of State has said, we are doing additional surge testing in parts of South Gloucestershire as a highly precautionary measure, and we urge people in that part of the country to come forward for testing. I would like to stress, though, that these individuals have followed all of the current protocols in terms of self-isolation, both on their return from the UK, but also after they've received positive test results and developed symptoms. We're also contacting individuals who were on the Swiss Air flight LX318, travelling from Zurich into London on the 10th of February, to provide public health advice and to test them and their households. More than 90% of the flight have already been contacted through the details they left on the passenger location form. If you were a passenger on that flight and have not been contacted, please call 0117 450 3174 to arrange a test for you and your household contacts. There was a third unlinked case. This individual did not complete their test registration required, so follow-up details were not available to the testing trace teams. This is an extremely rare event. Probably less than 1,000 of individuals who have a test through the community testing services we cannot trace in this way. But we know this is more frequent, about 0.3%, in those that do home tests or have tests through the surge testing service. We're in the process of doing everything we can to track down this individual, who we believe would have taken a test on the 12th or 13th of February. We're especially looking for individuals who may have taken a test through surge testing, those tests that the local authorities hand out door to door, and haven't managed to complete their online form, to either complete their online form or call one of the numbers that I'm going to tell you about. These numbers are 119 in England and 0300 303 2713 in Scotland, as soon as possible.
Thank you very much, Dr. Hopkins. And now I'm going to turn to Professor Van-Tam to set out more details on the good news in terms of the impact of the vaccines.
Thank you, Secretary of State. A few moments ago, Public Health England, with partners from across the 4 developed nations of the UK, published a new report summarising vaccine effectiveness to date as part of the England programme. Now, thank you for bearing with us because it has taken a while for that signal to stabilise, so we have enough confidence to give you some data, but equally it is still remarkably fast and a credit to our public health agencies that they've been able to do it in this very short period of time since our vaccination programme began. And I particularly want to mention Jamie Lopez-Bernal, Mary Ramsey, Nick Andrews and their colleagues who have done really an enormous amount of hard work to get us to where we are today in terms of our data. So the data I'm going to lay out for you are all data pertaining to vaccine effectiveness after the first dose of vaccine. and you have to be very careful about the outcome measures that you are describing, and therefore I'll go through them very carefully. The first outcome measure is outcome against infections, defined in this case as people who are ill with symptoms and who come forwards and take a positive COVID test. And the data are for individuals aged 70 years of age and over. And for both vaccines, we see vaccine effectiveness against illness after the first dose of approximately 60%. That was measured 28 to 34 days after the vaccine had been given. But in the case of the Pfizer vaccine, that effect is seen to be sustained into the 35-day plus time bracket. For AstraZeneca, in the 35-day plus time bracket, there is an early sign that that might still be increasing to around 70%, but the confidence intervals are very wide, and that is a less certain. But the figure I can be certain of is 60% effectiveness against illness. Now, obviously, there are still, unfortunately, because no vaccine is 100% effective, people who become ill despite having had that first dose of vaccine. But if you look at the reductions in hospitalisation that are occurring in those people who still become infected, and you add that to the fact that people who are not infected can't, by definition, be hospitalised with COVID, what that brings you to is an overall effect for both vaccines, in public health terms, that they are now preventing 80% of, reducing the likelihood of hospitalisation by 80% after one dose. So that's the second outcome, the hospitalisations data. And the third outcome is mortality. And because of the fact that mortality takes longer to measure, deaths, unfortunately, from COVID take longer to occur after hospitalisations. At this point, we only have data for the Pfizer vaccine, where the likelihood of mortality is being reduced by 85% in those over 70-year-olds. So that's really the summary. There's a lot of detail in the PhD paper, which is online, but I think you'll agree with me that although these data pertain just to the 70-plus age group at the moment, and our vaccine programme moves on with really significant pace now as we move into the lower age groups, it shows us, gives us those first glimpses of how, if we are patient and we give this vaccine programme time to have its full effect, it is going to hopefully take us into a very different world in the next few months. But we have to be patient, we have to push on with the vaccine programme, and most importantly, when you are called for your place in the vaccine queue, it's important that you come forwards and have that first dose, and when called for your second dose, and some people will be being called back quite soon now for their second doses, to come forwards for that too. Thank you.
Great stuff, Professor Van-Tam, thank you very much indeed. Our first questions are from members of the public, and the first by video